So welcome again to our Race and the American Story Symposium session on the COVID crisis. Just a quick heads up that we will have our last session next Tuesday at 3 p.m. To discuss the William Buckley and James Baldwin's debates on race. And if you would please follow us at race_AmerStory. Our wonderful grad student Yelena Sims has been live tweeting all these sessions. Also, this session is being recorded. So we have our YouTube station, and we already have our Thomas Jefferson session, as well as our music session already up on our website, which is raceandtheamericanstory.org. So I'm going to just quickly hand over to Adam to introduce our two guests, and then we will get going.
Great. Thank you, Stephanie, and thank you all for your patience and dealing with this with us today. So hopefully no more interruptions, and we'll move forward with this important topic. So we're very, very pleased to have our two guests joining us today. I'll introduce both of them. And then they'll each speak in turn, and then we'll go to a Q&A session after that. First guest, Dr. Andre Perry, is a fellow in the Metropolitan Policy Program at the Brookings Institution. His research focuses on race and structural inequality, education, and economic inclusion. Prior to his work at Brookings, Perry has been a founding dean, professor, award-winning journalist, and activist in the field of education. Perry is a regular contributor to MSNBC and has been published by the New York Times, The Nation, The Washington Post, TheRoot.com, and CNN.com, among other outlets. Since the COVID-19 pandemic began, Dr. Perry has documented the underlying causes for the outsized number of coronavirus-related deaths in Black communities. His Brookings research has illuminated how certain forms of social distancing historically accelerated economic and social disparities between Black people and the rest of the country. Perry also mapped racial inequalities in housing, income, and health to underscore how policy discrimination makes Black Americans more vulnerable to COVID-19. And this dovetails with the topic of his forthcoming book titled Know Your Price, Valuing Black Lives and Property in America's Black Cities. That book is being published by the Brookings Institution Press in just a few weeks. I believe it's available for pre-order.
That's right.
And I'll just read a couple of the reviews that have come out, so you have a sense for the topic and importance of the book. One reviewer says, "Know Your Price is a purposeful, in-depth, and critical examination of the pathology of racism, classism, and the self-destructive impact of American indifference." Another reviewer calls it a groundbreaking and important volume. And even higher praise than all of this, a reviewer says it reads as if James Baldwin was a social scientist. It's very, very high praise. So that book forthcoming in a few weeks and will be a very important contribution. So thank you, Dr. Perry, for joining us. I'll also introduce then our other guest who's joining us as well. We're very honored to have her with us, Dr. Patterson, Dr. Donna Patterson, who is chair of the Department of History, Political Science, and Philosophy at Delaware State University, where she also directs the Africana Studies program. Dr. Patterson is the author of Pharmacy in Senegal, Gender, Healing, and Entrepreneurship. And I'll read a brief excerpt from one of the many positive reviews of that book. This reviewer says that Dr. Patterson offers a compelling account of the robust, homegrown health professions that shows that the African continent is firmly a part of the international medical industrial complex. What is more, women have played a major role in this development. This timely book has a great deal to teach us, not least about innovative approaches to extending care and securing community health. So Dr. Patterson also has published numerous scholarly articles on pharmaceutical markets, women pharmacists, and Ebola in numerous academic journals. She's the inaugural editor of the new book series, The Rutledge Research in Health and Healing in Africa and the African Diaspora. She's currently working on two larger projects on transnational drug consumption and public health, and on the West African Ebola epidemic. Her media commentary on global health, international security, and current events has appeared on Slate, Washington Post, Christian Science Monitor, New America Weekly, Huffington Post, many other outlets. So we're very, very honored to have these two guests joining us today to talk about this very important current topic, but with deep historical resonance as well. So thank you both for joining us. Very, very great to have you. And as I mentioned first, we'll start with Dr. Perry. He'll give some comments for about 15 minutes or so. Dr. Patterson will follow and give some commentary of about the same length, and then we'll go to questions and answer period from the audience. So without further ado, Dr. Perry, you want to get us started?
Yes. First of all, I want to thank the organizers for having me. I know it's difficult dealing with the trolls and the Zoom bombers, but that's indicative of the work that we do. There will always be haters out there who want to disrupt progress. And we're going to have to be steadfast in dealing with these trolls. But you know, what I always say is we still need to go to the deeper, the roots of the problem. You know, cutting off people on the internet or on chat rooms won't solve this problem. It will take work on the structural inequalities that have been laid bare by COVID-19. And that's where I want to start. Over the last month or so, I've been inundated with requests about how to deal with this crisis. From a business perspective, folks are rightfully worried about the state of small Black businesses as they are struggling to stay alive during this period. Folks want to know about the housing crisis and affordability during this period, as many are left out of work, and a number of other issues, health, of course. And I say that in order to solve this problem, you're going to have to also solve the structural inequalities simultaneously. There are a few moments in time in our history where you've seen significant attempts to change the structures in our society. One of which was the Great Depression, of course, and the New Deal policies. And that's an analogy I like to use. That episode, the Depression, we got out of it by investing in poor people. And the folks who are more likely to have a chance of survival during this period were actually the descendants of people we bailed out generations ago. And and unfortunately, the people who are not protected, or the people who are suffering worse consequences, are the people we left out of the New Deal. That it was the Black folks, and a lot of my research revolve around housing devaluation and housing disparities, because so much revolves around the state of housing in our country. But let's make no mistake about it, that throughout history, we've had opportunities to solve for structural inequality, and each time we pass on it. This time is no different. We must fight to install policies that will restore the value that has been extracted by racist policies throughout time. My book is titled Know Your Price, Valuing Black Lives and Property in America's Black Cities. And I talk about how redlining, the impact of redlining has an effect today. It's one of the chapters in the book. I talk about my family and my family story. They grew up between Pittsburgh and Detroit. My father, as the story is told to me, an older woman by the name of Elsie Boyd took me from my birth bed, where my mother gave birth to me, and took me home to this place called Wilkinsburg, Pennsylvania. My mother was poor. It more than likely she was abused. She already had a child. She was 18 when I was born. So she struggled. My father was murdered in prison outside of Detroit. And the story went that he died breaking up a fight in prison. At the time, I didn't necessarily believe that. I didn't meet him. And I just thought that it was a story they told me to bring some humanity to him. But just recently, I started following where he lived. And it turns out that he lived in neighborhoods where housing was devalued. And when I mean by devalued, you can look at this on one of my reports, the devaluation of assets in Black communities, which is on the Brookings Institution website. But I basically looked at housing prices in Black neighborhoods and compared them to housing prices in white neighborhoods. Black neighborhoods being where the share of the Black population was greater than 50% versus those where the share of the Black population was less than 1%. And I controlled for all those metrics that people say are the reason why, as you can suspect, home values or home prices are lower in Black neighborhoods. I controlled for education. I controlled for crime. I controlled for walkability and all those fancy Zillow metrics you find. And what I found astounds, quite frankly astounds. Homes in Black neighborhoods, equivalent homes, apples to apples comparison. Equivalent homes are priced 23% less than their white counterparts, about $48,000 per home. Accumulatively, that's about $156 billion in lost equity. That's just 2017 numbers, just 2017 numbers. Now that 156 billion should have been used to send your kid to college, their kids to college, to start a business, to fix up your home. It's used by municipalities for better schools, for better infrastructure, for policing, all those different things. It's the money used by people and communities to lift themselves up. But from the jump, homes in Black neighborhoods are devalued. There's nothing wrong with these homes, but they are devalued by the concentration of Blackness, meaning they are devalued by racism, by negative perceptions. And why does that matter? Today you hear about struggling businesses, Black businesses all across the country. Well, they're struggling because Black folks have not had the access to capital. So they did not have relationships with banks. We did not have the money to withstand the inevitable shocks that will happen. You know, we keep talking about COVID as if this is a once in a lifetime thing. Yes, we might have a pandemic like this is unprecedented, but in the last 30 years, let's be clear, we had the tech crash, the housing crash, Hurricane Katrina, 9/11, Hurricane Maria, a number of crises that shut down the economy. And guess who, in each instance, had a harder time recovering? Black and brown people. The reason being is that we never deal with the source of the problem, which is the structural inequalities that replicate the inequalities that persist and are exposed during this crisis. And so for what I'm calling for in this book, because I used my father's story to show that yes, he died in prison at the hands of someone else, but he also lived in areas that were devalued, that did not have the tax revenue. My family owned businesses. They did not receive the profits that they should have received. I show empirically that every day in education, healthcare, housing, economic development, Black and brown people are paying a Black tax that's preventing the economic mobility that will sustain families and communities. You'll hear me say this all the time, that there's nothing wrong with Black people that ending racism can't solve. that if we look at the policies and address the policies that have endured, we can overcome these regular incidents or tragedies. Again, these things will happen over and over again. If we don't address the structural inequalities, we'll be back in the same position when the next tragedy strikes. I just want to also talk briefly. I also did another study on business evaluation, and where we looked at quality of businesses in Black and white neighborhoods. And what we found, again, astounds, but most people, they look perplexed when I tell them the findings. We scrape Yelp data for all the businesses across the country. And what we found that businesses in Black neighborhoods owned by people of color are actually are rated higher on Yelp. So the quality is not the issue. So a lot of these, the reasons why we haven't had positive policies for Black and brown folks, benefiting Black and brown folks, is because we live in this narrative that the state of Black cities are a direct result of the individual behaviors of the people within them. That they say, oh, my father was a drug addict and he was a violent person, and therefore, why give a neighborhood resources to rebuild? But the reality is that my father and millions of Black and brown people are robbed of the opportunities by structural racism to live decent lives. And so I'm no different. No, I'm no different from my father. I mean, they're pretty much the same. I had a few people to help me along the way, but he was no different than me. And a goal of my book then is to show that, hey, again, there's nothing wrong with Black people that ending racism can't solve. In addition, the wisdom of our ancestors who told us our ice is just as cold holds up empirically, that our businesses are quality, our homes are quality, but they are devalued. And we've got to eliminate the policies that devalue Black and brown people if we are to achieve equity in this country. So I'll leave it there, and I look forward to hearing from Donna, who we lived in the same space in New Orleans for a little while, and so I got familiar with her, and she's a tremendous asset, and it's good to open up for her.
Well, thank you, Andre. And thank you, organizers. Thank you, Stephanie and Adam and the rest of the team that put this together. So I'm gonna take a different take. I'm gonna start with a current event and kind of historicize it and bring it back to the present. I'm looking at this more through a public health lens because my work and my teaching, as Adam said in the intro, is more grounded in public health. And there are inequities in that, and we'll talk about this a bit as we move forward. So earlier this month, during an interview, a televised interview, two French medical personnel, one Dr. Jean-Paul Mira, and another doctor, they were talking. And so they were asked about testing. And Jean-Paul Mira suggested that Africa be used as a test site for a COVID vaccine. And he said, quote, "Where there are no masks, treatment, or intensive care, a little bit like it's done, by the way, for certain AIDS studies or with prostitutes," end quote. And so this was co-signed by his colleague in the interview, who's also the head of the National Health Institute in France. And so some of you may have seen this. This was a bit of controversy about this idea of using Africa as a laboratory. But I think too, if you go back and look at his statement and unpack it, there are a lot of racist tropes in there about, he says there are no masks treatments or intensive care in Africa, which we know is not true. My work is on public health institutions. I work on pharmacists, for instance, in Senegal, where women own 65% of the pharmacies in Dakar, Senegal. Pharmacies, you know, just like Walgreens and CVS that you go to, for instance, but there are intensive care facilities. Now, there is some dearth in some of the spaces, depending on where you are, and particularly in rural areas, just as they are in this country. But at the same time, a lot of these things exist. And in some cases, the medical care is quite state of the art. But in response to this comment, the head of the World Health Organization, Dr. Tedros responded during the daily briefing on April 6th. So all of this happened in the matter of this month. And he said essentially that the hangover from the colonial mentality needs to stop. And this was in response to these French comments. And he condemned this in the strongest words possible on behalf of WHO. Now, this led to a lot of backlash. I should say, Dr. Tedros has been trolled through this response to the COVID pandemic. He's been trolled. I even tweeted a bit about this, and the trolls responded in the mentions. But he is not only trolled, but also is receiving a number of death threats. And that death threats, other WHO officials, extensive trolling, but also hacking attempts, both for him and other WHO professionals and others who are trying to respond to this pandemic very quickly globally. In addition to some of those exchanges, about a week after this happened, the President of the United States, Donald Trump, also started a series of attacks against the World Health Organization, and some of them directed at Dr. Tedros directly. He began by placing the blame on WHO for the kind of being slow in responding to COVID. And some of this had come from reporters asking Trump about his response and what had taken so long for US response. And then he framed this and kind of deflected this onto the WHO. And then he went on to say that he would revoke US funding to the World Health Organization in the middle of a global pandemic. And so that happened. And I think a lot of people were surprised, but at the same time, it wasn't that surprising given how the US responded when this started. As you all may know, that it took a long time for testing to roll out in this country. And one of the reasons it took so long for testing to roll out is because the US government did not want to use the WHO approved tests as most of the world was using, but they wanted to develop their own tests. And so not only develop them, go through approval. So it takes time. CDC develops a test. You had other organizations developing tests, FDA approval. Some of the tests didn't work properly for a variety of reasons. And this was one of the reasons it was so slow for testing to roll out in this country. So by the time we were really rolling out tests, we already had people who had died from COVID in this country. I remember when we were really trying to roll out testing, if you looked at Washington State, for instance, where you saw these pockets at these centers, at these nursing homes and other people, we started to see community transmission. You knew people had COVID. And a few were able to get tested, but most of them couldn't. At some point at one of those nursing homes in Washington State, there were about 30 people who had all the symptoms, both residents and some of the workers there, but they were not tested for COVID. And I remember talking to some journalists about this when they were asking me about testing. I'm like, we have to scale it up. We have to scale it up. And we still need to scale it up, but we can come back to that. So going back to WHO, so again, the death threats, a lot of fallout, particularly from right wing. But there was also a lot of support. The Chinese government, yes. Also Jack Ma. But also leaders from Norway, from France, from Canada, the head of the African Union, the president of Rwanda, the prime minister of Ethiopia, and many other people came out in public support. So going back to testing, so given those comments about testing, one country did agree to test, the Congo, Democratic Republic of Congo. So they did agree to testing. One African country did agree, and those trials would begin in July if there is a test available. But at the same time, it's somewhat controversial. But if you look at the broader context, one of the reasons that I believe that DRC agreed is because they've been kind of in their own living laboratory of Ebola testing. particularly in this latest Ebola crisis that's been happening since 2018. It started some with some experimental vaccines during the 2014, 2016 Ebola crisis. But if this recent one in the Congo has been a main test center for this. So you have people really that support it, but you have others who don't want it, which also I think is a very important issue as we think moving forward with COVID-19. What does that look like? Will everybody agree to accept the vaccine? Who will agree, you know, to have this injected in their body if there is a vaccine? Because everybody may not agree. What are the side effects of the vaccine? And so those are some of the questions to think about too as we're moving forward. But two, just putting this in a broader context, Africa has been a living laboratory of both consent, mostly in recent years, but a larger historical trajectory of biological experiments and testing without consent. And so what does this look like? It looks like vaccines, but it looks like other interventions and primarily reproductive control. So in terms of reproductive experiments, you see this both on the African continent. You see it in West Africa, you see it in East Africa, you see it in Central Africa, and we've seen it historically in different parts of the continent. So historically, what did that look like? It looked like birth control pill trials. It looked like sterilization. It mostly looked like this. It manifested in these ways. But not only in Africa did we see this, but we also saw this in the African diaspora. We saw this in Puerto Rico, where the 1980s, 1/3 of all women of childbearing age had been sterilized. And Puerto Rico has this very long historical trajectory going back to the 1930s in cahoots, primarily with the US government, because, you know, Puerto Rico is a part of the US government, in controlling the population so that the corporations kind of go out along the country. And so that was part of it in terms of population control on the island for space, but also in terms of flights and immigrating people to New York and other places in other ways of just kind of freeing up space on the island. There are lots of studies and those sorts of things on this. But also not only in Puerto Rico, but also in Brazil and in the United States in places like Mississippi. Fannie Lou Hamer talks about how she was sterilized in North Carolina and other places in this country. So this is what this looks like historically. In more contemporary times, and not completely now, but I'd say from the 1980s on, what does this look like? This looks like experimental and state-sponsored use of trials of Depo-Provera, Norplant trials, pharmaceutical trials, and again, the Ebola vaccine. And so these experiments not only using Africa and the African diaspora as a test site, if you will, but it often manifests in the bodies of Black women, particularly when you're looking at reproduction and contraception. And one of the and beyond Black women, one of the most famous ones, even though you have all these examples of Black women, one of the most famous and notorious examples of this is the Tuskegee syphilis experiment, where syphilis was tested in this population of Black men in Tuskegee, Alabama. And so we look at the men because they were targeted, but then that also impacted their families, potentially their wives and their kids, some of them who also contracted syphilis. And we know what the stages of syphilis look like because of these experiments and how they were able to document it in these men. So back to COVID-19 directly. And so this testing was not only suggested for Africa, but there's also been suggestions of testing possible vaccines in places with large Black populations, including Detroit. So that's been thrown out there. So what will that look like? So what I want you to think about as we move forward is who's used in drug trials, whose bodies are used, but also who benefits from experimental serums and new vaccines, or the same people who are being tested on having the first access to these new drugs.
Thank you, Donna. Thank you, Andre. Wonderful remarks that really open us up to, I hope, a really engaging conversation about this. I think, you know, when we put this together, Adam and I brainstormed and thought that you both could bring something to the table. Andre from a more US perspective, and of course with Donna looking at the diaspora and Africa. If there's one thing, and I do want that t-shirt, Andre, there's nothing
wrong with black
Black people.
that ending
Other
racism
than
can't solve.
raising racism, exactly. So I'll be first in line to buy that T-shirt.
Look at it.
Yeah. So I think that that quote is central to both what you and Donna were talking about. Andre, looking at it more structurally within the United States, and then Donna is reminding us of the global systemic racism that comes along with colonialism and imperialism as well. So while people are thinking of their questions, I want to remind you that you can click to our participants, you can click on the participants little icon at the bottom of your Zoom screen. It'll show you a list of everybody in the room, and there will be something there that says raise hand or lower hand. So please raise your hands if you would like to say something. You can also just raise it on the screen as well. But while you're thinking of questions, let me start with one for both Andre and Donna. I have many, but let me just start with one. Both of you have written about race and racism. So Andre, your book, Know Your Price, Valuing Black Lives and Property in America, what would you add to your to that book? That book is out. It's done.
Yep.
But if you were to add an epilogue after this crisis, what would you add? And I'll ask Donna the same question for her work on pharmacies in the Black world. So Andre, would you start, please?
You know, it sounds, this might not sound sincere, but I probably wouldn't change much about my book. The only thing I would say is, hey, this is another opportunity to solve for the structural inequalities that have been laid bare by the epidemic. That there's only a few times a decade where you see large outlays of cash going towards communities, and they typically happen after tragedies. And certainly this is no different than what I write about in the book. I write about the Depression, I write about various economic crises, and how the assets in Black communities helped us survive. And if it were not for those assets, I don't know where we would be. And so, but it's also important to note that we have to invest in those very assets if we ever want to see growth. So the only thing, you know, I would say that this is yet another opportunity for us to do the right thing. And, but history has shown that we use this crisis to assuage white pain and not address the structural inequalities that are apparent.
Yeah, and of course, the follow-up question, Andre, would be when you say, you know, this is an opportunity for us to work on these issues. Who is us? Like who's in the room when it gets time to create these strategies to get out of this?
Yeah, I'll answer that a couple of ways. If there's one thing this pandemic has taught us, is how interconnected we actually are. That when your neighbor is sick, you are vulnerable. That we see it in this pandemic more so than any other area, but it's also true with the economy. It's just that many whites cross the threshold where they don't feel the pain, right? They don't see how the racism that's hurting Black people is actually throttling the entire economic structure. And so like it or not, we need everyone involved in this project. There's another answer. I titled my book, Know Your Price, based upon the play, Two Trains Running by August Wilson. In the play, the main character Memphis is about to have its property seized through eminent domain. The city of Pittsburgh, where I'm from, offers Memphis $15,000 for his property, in which the owner, Memphis, goes, no, I'm not selling my property for $15,000. I know my price. I got my price. That I'm paraphrasing. There's another character, and it's a refrain throughout the play. I got my price. I know my price. There's another character, Hambone, who paints a fence for a proprietor in exchange for a ham. He paints the fence. He never gets his ham. Throughout the play, give me my ham, give me my ham, give me my ham, until he goes crazy and dies. There's actually a happy ending. I know people are like, damn, that's depressing. But it's a semi-happy ending. The main character gets $35,000, well beyond the $15,000. And the moral of the story is, you better know you have worth. More importantly, you need to stand on your price, even if it means going crazy and dying.
Mm-hmm.
The people in this room, in this chat room, or we have got to know our price, and we have got to stand on it. You know, we're all in this together. We need those who are against us to be a part of this, no question about it. But we're not going to move people who have no incentive to change unless we demand it. And so that's how I answer the who is the we, who is the us. It's all of us, but many are going to have to demand change to force the others to come along. Thank
you. I love that you mentioned an August Wilson play. We just did Joe Turner's Come and Gone, which also has a really wonderful message there about worth and value.
That's exactly right.
But let's go to Donna. Donna, epilogue for your book. What would you add?
I actually did kind of add an epilogue of sorts in the conclusion to my book, because as my book, we were, coming to the end of the publication process, the Ebola epidemic was happening in West Africa. So I wove a little bit of that in there. But I kind of thinking about what's happening now, my project that I'm working on, Ebola now, I'm thinking of reframing that and somehow tying in some of this and perhaps some of the work I've done on Zika into that project. So that's what I've been thinking about. And I really like that Andre brought up this idea about the world being interconnected, because that's what I'm always screaming about in terms of global health. And I wrote about that a lot with my Ebola work, because I think people thought, Ebola is sitting here in West Africa, particularly as I started doing a lot of the early media work on it. I think, it won't get to us, it won't happen in the US, and it did. And we saw how it came to the US and who was infected. But we were able to contact trace very quickly and contain it very quickly. And I think, that's something that didn't really happen with COVID in terms of really even now there's been very limited contact tracing that has happened. A few states are saying that they're going to start gearing this up, but that is one of the basic pieces of responding to an epidemic. And hopefully moving forward, there'll be more of that as things start to calm down.
Thank you, Donna. Let's go to Naomi, one of my students who had a question. Naomi, where are you?
I'm here.
Hello. Hi, Ruthie.
Hi, how are you?
That's Naomi's mom, who constantly Zoom bombs into our class discussions.
Hey.
Hello. You guys mentioned a lot about experimentation on minorities, and I just wanted to get you guys' opinion on how Puerto Rican women in the 1950s were used as guinea pigs for experimentation on birth control.
Okay.
Ooh, I don't know about that particular case or cases. I do know this, and just to add to what Donna said earlier, much of the response to Black lives has been about controlling them and controlling the population. Mm-hmm. So when we test in different aspects. Like in right now, we're testing essentially whites in upper class neighborhoods for COVID, while we are allowing essential workers, predominantly Black, because we're disproportionately in service jobs or jobs that are essential, and we're disproportionately in health service jobs. So in this regard, you see a lot of testing going on in the whiter, richer areas in New York per se, and no testing going on. But but when testing does go on, it's generally to benefit white folks. So I agree with Donna in this regard. When we start looking for the antibodies, when we start testing vaccines, we should look at the power dynamics there, because history has shown that Blacks have been used as guinea pigs. But for women in particular, there's been an effort to control their bodies, control the who and when they can have birth, and whose children women should take care of. It's something that historically has been proven, and so I'm never surprised to hear about places where population control has negatively impacted Black and brown women.
Mm-hmm. I'll add a bit. He's covered a lot of it, but in terms, I mean, I talked a little bit about this in terms of in Puerto Rico directly earlier. So the testing looked, a lot of it was focused on sterilization. And women, even in getting sterilized, many of them did not know that this was something that could, that was permanent, if you will. And they had to get consent from a male relative, generally a husband or another male relative, to have this procedure occur. And so that was one of the pieces. Also, a lot of the birth control trials, Depo-Provera trials, they were used in Puerto Rico and tested in Puerto Rico and some other places too, Brazil and other places, before they came to the West. So before they came to the US, before they came to Western Europe in particular. And so this is why some of the birth control pills did not even make it to market, because of the side effects, and also the way that you know the side effects now on those boxes, that little sheet that you have in, is because they saw what happened to these women. And so, and the ones with the more severe side effects did not make it to market. So certainly that testing was very prevalent. Depo-Provera, they learned in a test caused cancer. So a number of countries, I know some Western European countries, banned it for years because of that. But it's used fairly widely in the United States, for instance. But in the United States, there was testing on brown women too. So not just Black women, but also brown women. So some Puerto Rican women, some Mexican American women. I know a lot in terms of Mexican American women in parts of the Southwest where this happened. So it wasn't just Black women, but Black and brown women for certain.
Okay, great.
Thank you.
Thanks.
You're welcome.
Thanks, Donna and Andre. We have a few questions waiting in the wings, but let me quickly read. I thought David Krause, a good friend of mine, raises a question I'd like you both to help us with. And the question is, recognizing the deep structural problems which you've both mentioned, what advice would you give to leaders of NYC, New York City, Chicago, New Orleans, and Detroit today as they confront severe healthcare inequities? So if you are able to give those leaders, whether the mayors or the governors, advice, what would you say?
Well, I actually did talk with a governor and a mayor in the last 2 days. And what I told them is that every state needs to do an equity audit of the practices and policies that negatively impact Black and brown people, be it in procurement processes, be it transportation policy, that many states honestly have not scored their policies in a manner in which Congress scores policies in terms of their impact on the federal budget. We should be scoring policies in relation to their impact on Black and brown people in this country. That we cannot leave it up to just guesses on whether or not our policies are having a negative impact. They clearly are. You know, that the COVID does not discriminate, but our past and present policies do. And that's what you're seeing. And so it's incumbent upon us to identify those policies in each state and in the country as a whole. And so I propose to them, hey, one, let's create a commission, a policy or a initiative to look at those things. In addition, I'm just a big proponent, you know, call it reparations, call it what you want. We can identify the monies that are lost through housing devaluation, through economic injustice. We can come up with those metrics. That's what I do in my research. We need the same folks who receive stimulus checks understand when times are hard, it takes a boost it takes stimulus. And in the past, we've done that for poor white folks. We need to do that for poor Black folks, for rural communities, that the wealthy have used their wealth to influence policies to tilt to their direction. So the tax policies that are built for that, you know, 0.1%. Didn't just happen. It happened because the wealthy lobbied for those policies. We've got to mobilize, and put pressure to make sure that the people who are hurting receive the kind of attention that we give rich people.
Right.
And that attention would certainly manifest itself in some type of stimulus for Black and brown people and Black and brown communities.
Okay, and maybe we should mention that word reparations, but we won't go there right now.
I'm all for it. Oh, and one more, I will say one more thing. In terms of testing, I mean, in a perfect world, we would have testing available for everyone and pull people back into the economy when folks either have the antibodies, are safe to go back, and we would put particular attention on essential workers. I'm going to, I have a town hall with members of Congress here, I think next Friday. And one of the things I'm going to recommend is that we federalize jobs during particular epidemics. Our Grubhub drivers need the same kind of benefits as civil servants. The folks who are working in grocery stores often don't have health insurance because they're working part-time. There are clearly workers who are put in harm's way to keep the economy going, and they're disproportionately Black and brown. That's why you're seeing so many deaths. And so we've got to figure out ways to federalize workers so that we can test to make sure folks are safe, that we can provide the resources, the benefits, so that if they do get sick, they have the ability to go to receive proper health care.
Right.
And it will help better organize the recovery efforts if we federalize these jobs.
Okay, thanks, Andre. Donna, same question for you. I imagine your advice would be to a different group than Andre would be talking to.
I mean, I think the economic piece and the housing piece is really important in terms of what he said, because his was very comprehensive, so I'm not going to add too much. But I think the big piece too are the health facilities and the access. So not only in the rural areas, but also in the urban areas, places like Detroit. where one of the reasons you see a lot of people dying in Detroit is because of the dearth of the health facilities that the populations that are primarily dying have access to. But you see this in other cities. You see this in Southeast DC. You see this definitely in the rural areas. And so, you know, scaling up health facilities, what does that look like? Maybe putting more money into training people here on site, because a lot of our doctors and nurses, they're being siphoned off from other parts of the world. And so why don't we focus more of our energies here? Maybe, you know, find ways of funding medical school, nursing school, midwifery school, maybe forgiving loans and different things to have more people in this country be able to pursue those opportunities. And so that would be, I guess, my big pieces there.
Yeah, that's great, Donna. Actually, one of our students, one of our Black Studies students is getting ready to apply to med school now. And I wish that policy were already in place for him as a young Black man. He'll ask a question in a minute, but I do want to go down the line. Arlene, you had a question. Arlene, we can't hear you.
Yeah. Okay. There seems to be, it's very frustrating. There seems to be a refusal to test. You know, I mean, they keep talking about testing and it's ramped up, but you can't, even in Northampton, you can't get a test unless you have symptoms. But I'm just thinking about the refusal to test and a new way to kill off communities of Black and brown people. You know, it might be very far-fetched, but if you look at our history, I don't think it is, and the things we've talked about. And I'd just like to have people comment on that. The lack of testing, in addition to the lack of facilities, but testing seems so basic, you know, and it's not rocket science. You test people and then you find out whether they're sick, and, you know, you can do a lot of stuff.
Donna, anything on that?
Yes, I think one of the big reasons why you're seeing such a dearth in testing is because you don't have the tests. You don't have the testing capability yet. We are still trying to develop that capability throughout most of the country. Even in New York, that has tested the most in the country, the most in the world, in fact. You know, you hear Cuomo every day talking about how many more tests that he needs in his state. So that's a lot of it. And I think early on, because I've been frustrated throughout this in terms of the lack of testing. And I think too, it wasn't all clear because this is a novel coronavirus. You know, what does this look like in our response to it? Because we haven't seen anything like this in our country, you know, since, you know, early 20th century with the influenza pandemic. And so we weren't ready to prepare in some ways, but also that lag that I talked about earlier in developing a test. But then you have to scale up the test, you know, and then once a vaccine comes, if a vaccine comes, you have to scale up a vaccine. So it's not going to magically be available to everybody at once. So I think this is something else to think about. But not only the symptoms, Arlene, you have to have severe symptoms because doctors are turning people away every day who they know have COVID, but their symptoms are not severe enough. And so by the time someone potentially is tested or hospitalized, or in some cases hospitalized before they're tested and die before the test results even come back, often they're in a much advanced state. And what would that have looked like? Would you been able to save that person if you were able to test them and treat them much earlier?
And South Korea can do it, but we can't, right?
Well, I will say this, that it was really because we did not believe it was a crisis. I mean, you had a lot of
crazy government
folks who just ignored it, and you know, they just didn't see our interconnectivity. As was mentioned before, they ignored it, and by the time it trickled in, it was too late. You know, you really have to jump on these things quickly. And I read, I think in the notes, someone commented, they think that there's somewhat of the motivation to not test is because it will kill off Black and brown people.
That's what I was saying.
What I will say to that is that there is a callousness that clearly is at play, that the people protesting don't see the numbers I'm seeing, and they don't care to see the numbers I'm seeing. That when you look, and you can go in any city, Go look who's driving the buses.
Mm-hmm.
Look who's still working in the grocery stores. Look who has to work, you know, and Black people, again, I stated that there the two areas where we are predominate is in the health and service fields.
Mm-hmm.
And so because those are our main sources of income, we can't just leave our jobs.
Right.
And so it's incumbent upon the federal government to have a racial equity lens when they are distributing tests. When you have scarce resources, that's when you apply some type of equity lens. And they did not distribute the few tests that they had in the areas to the people who need it first. And those should be our essential workers. You know, I have the privilege of working from home, doing webcasts from home, doing all these different things. You know, it's a lot of people have to interact with hundreds of people a day. And a lot of those people happen to be people of color. So I'm not going to go as far as say it's an attempt to kill off Black and brown people, but in effect, it is killing off Black and brown people. So so I'll just leave it at there.
Yeah. Andre, thank you. Let's go to Jackie.
So I know you already kind of answered the question on what you would say to a mayor or different people who are running a city, but what would you say to an individual person, like going forward, what am I supposed to do as a student or as a young person to try to also be able to help in the future?
Well, my response is always join an organization, be a part of a movement. That, we for this issue, we're looking for an immediate response, but and an acute one, and I understand that. But what will really get us over this hump are people who we might be socially distanced because of the pandemic, but we have to stay connected. We have to stay on this president and policies and state and local leaders in terms of the policies that put forth to make sure that we are taking care of folks' benefits, pay, safety equipment, but more importantly, that we are distributing resources that will close some of the economic gaps that make people more vulnerable. Remember that Black people have about 1/10 of the amount of wealth as their white counterparts. So on average, the median wealth of a white family is about $170,000. The median wealth for a Black family is about $17,000. That wealth is the buffer of protection that people use when things go wrong. When they lose it, when folks lose a job, somebody gets married, somebody gets divorced, something happens, you draw upon your savings in times of need. A lot of people don't have savings. They go into debt. They have to work in horrible conditions, and this is what happens. And so we've got to figure out long-term strategies to address these inequalities that show up when these disasters occur. But mobilize, get involved with an organization. Even this class is a form of a mobilization opportunity. You know, what are you going to do with this moment of being together?
Right. I just want to brag on Jackie just for a second. She's in my class, but she's auditing it and she's doing all the work for it. She had a full set of classes. She didn't have space, and she stayed, came to every class, did every assignment, and this is, I think, the road that we hope many of our students take. So Jackie, thumbs up to you. And she's the one that just asked that question. Adam and I are also thinking about ways to keep this conversation going in the summer, and we'll have that roll out sometime in the next couple of weeks. But let me go straight to Terrell, who's been waiting to ask a question. Terrell?
Hi guys. I kind of just wanted to ask, basically, as testing, or if testing becomes any more accessible to Black and Brown individuals, how could we properly kind of address health inequity and medical racism within like the educational clinical setting? Because I feel like as we've kind of talked about, like there's been like a history of, you know, testing on Black individuals, like the Tuskegee like experiment, stuff like that. There's a lot of skepticism among Black people in terms of like trusting their healthcare providers, and at the same time there's a lot of like skewed ideas around Black bodies. So I was wondering like how we could kind of address, basically in terms of like education, or how could we better teach for like cultural competency, if anyone has anything.
Well, I think cultural competency is a big piece of that. You know, kind of in some cases education or re-education of health professionals, incorporating some of that into medical school. I mean, there are some places that have these sorts of things, public health more, but, you know, having classes thinking about these things, talking about, you know, what, you know, racial health inequities look like, and talking about it more directly, because that's one of the things that I think we're seeing in a lot of, you know, people talking, a lot of feedback from some of the experts, and they were like, what about this race piece? And, you know, what about these, you know, kind of larger social determinants of health? And why are you not talking about this? And why are you not addressing that? And how can someone, you know, at the same time, how can someone, you know, get a medical degree and not really be conscious of these things? So making it more conscious and less kind of unconscious, or if it's not even in the unconscious mind, kind of bringing it forth. So I think in terms of, you know, how people are structuring curriculum, how professors are structuring their classes. I teach global health, for instance, and, you know, people come out of my global health class, you know, with a well-rounded view of a lot of different things. And I've been teaching some form of this class for more than 10 years. And a lot of the students go on to have careers in health. Some of them go to medical school. A lot of them go and get a master's of public health, and they work in the health industry in different ways. And so I think it's interesting to just put it out to the students that you can and the people that you can, to start educating and retraining. And I know Andre probably has some more on this, since he was talking about it earlier.
Yeah, you know, my wife is a OBGYN, so I get to receive training from her on these topics all the time. And she reminds me how physicians also have, are taught the same biases that everyone else is taught. So that the idea that Black women can endure more pain than other folks, that's a belief that dominates the medical profession. You have biases in all aspects of medicine. And so part of this is getting to the heart of education in general, not just medical training. While that certainly, it's phenomenal how folks, even in medical profession, who certainly know some science, don't necessarily know that Black people aren't any different biologically, really, from white people. But there's still this belief in Caucasoid and Mongoloid and Negroid. I mean, it's so ingrained in our belief system that it manifests itself in different treatment of patients when they are presented in hospitals. I recommend that if you have a chance, follow the Black Mamas Matter Alliance and other groups looking at maternal mortality issues, because that's where you see where Black women can't buy or educate their way out to better birthing outcomes. And it's really because of the structural inequalities that persist. And until we educate health professionals and others on these structural issues, the training itself will be corrupted. And so this is a very good question. It's very intuitive. We got to get to address these issues through education. No question about that.
Right. I think we do have a few more questions. Our time is running, but we'll add on a few more minutes because of our little snafu at the beginning. I would love to hear from our colleague. I haven't even given her a heads up, but Eleanor Seaton is our ASU colleague who is our STEM person on the team. Not quite on the team yet, but we want her on the team. And so Eleanor, you're a scholar of psychology. Any thoughts or questions, things that we can think about given what Donna and Andre have said?
I was actually hoping to slip off, but thank you, Stephanie, for, calling me out. Hi, everybody. As Stephanie said, I'm a psychologist by training. I study the impact of racism on the mental health of Black youth. I agree with everything they said. A couple things I'm going to leave you with. One, it's really important to have these conversations because there's a lot of chatter about why are we seeing disproportionate impacts of COVID-19 among Black populations, Native American populations, and in New York City, Latino populations. So it's important to have these conversations. It's important to sort of centralize structural racism in these conversations. I can't tell you how many of my white colleagues have reached out to me wanting my opinion. And I'm like, well, first of all, structural racism is a starting point historically and contextually. And I think COVID-19 is just exacerbating these issues that have been present for centuries now. And I also say it's really important for scholars like us. I'm a Black woman, I study racism, I live racism. I'm the descendant of enslaved Africans. So my family has lived racism for centuries. It's really important for us to have conversations with our white colleagues. That's not something that I've always been wanting to do or willing to do. But I find myself in places where I have white colleagues who are genuinely curious and not malicious and want to know so they can start to get involved in sort of how to change things. Now, specifically, I'm interested in how racism gets under the skin. So my work is moving in the direction of looking at biological outcomes. My most recent study looked at cortisol in the context of stress. And I end up talking to people who spend a lot of time studying animals and saliva and blood, looking at cortisol or CRT, or all these biological processes. And similar to what Andre just said, it's been jaw-dropping to have normally intelligent people tell me, well, I find biological differences in, say, the stress process. I think it's due to race. And in the 2020, in the year of our Lord, for me having to explain to people it's not race, it's racism, and let me give you a quick study, has just been jaw-dropping, but necessary. No, you're not looking at racial differences on a biological level. There are none. What you are looking at is how racism historically has structured differences biologically over an intergenerational process. And having to explain that, having to break that down, giving my colleagues, some of whom are more senior than me, reading assignments, because I believe in homework. So I said all that to say it's really important that we have these conversations with our white colleagues, because whether we want to admit it or not, like Andre said, our white colleagues were taught in the same classes we were taught. They were taught these same biases about Black people are fill in the blank, white people are fill in the blank, and they have a lot of unlearning to do as well. And so I think, for people like us who have somewhat of a clue, we've got to think about educating our colleagues who in turn educate their students, who in turn educate our students, if we ever want to change things. One of the things that I'm pushing back on my white colleagues about is, now what are you gonna do with your white family members who are Trump supporters? Because this entire debacle has been caused by racism. Racism elected this man who was incompetent, unintelligent, narcissistic. I could go on forever about him, I'll stop. And more importantly, are you gonna talk to your family members so that they don't do this again? Because newsflash, you guys are gonna die from this because the coronavirus is colorblind. And you may see what's happening in urban cities now. It's coming for rural America. It's coming for you. So we have got to start putting the heat putting the fire under the feet of our white colleagues and getting them involved in this. They can no longer sit on the sidelines. They can no longer look from a side, tisk. No, you've got to now do something about the racism that you guys have had since 1619, if we want to be honest, or 1492. And now you guys have got to do something, because I blame all of this on white people. If we want to talk about blame, if we want to talk about who's at fault, I'm going to say the majority of white men and women who voted for Trump. I'm going to start there, and I could go back, but I'm going to end there because I've got to run to a 2:30 meeting. And I hate to run out. Adam and Stephanie have my contact information. I don't want to sound like I'm leaving because it might get hot in here. I literally have another meeting. So
drop the mic.
Thank you.
Drop the mic. I love it.
Drop the mic. You got something to say.
Ooh.
Okay, let's
make sure you send me your information.
Okay.
Yes, me too.
Yes. And as we start to wrap up, I want to hand it over to Adam, who had a question, but I've been shunting him for a little while. Adam, maybe last question.
Oh, thanks, Stephanie. Yeah, and I don't want to prevent other people from asking questions who've been waiting, but yeah, I'm glad Eleanor got to say her piece. That was great. Great colleague at ASU. So yeah, my question has to do with kind of looking forward and asking whether there's something we can learn from the COVID-19 crisis and the way that it's exposing structural racism. Is there anything we can learn from it so that we come out of the crisis better with respect to structural racism than we went into it? And thinking just historically, right, there's so many times we've gone into crises like this, and you would think that it would have woken people up to these issues that continue over and over again to disproportionately affect communities of color and black communities across the country. So is there a way that we can learn from this crisis, or a way that we can come out of it better than we went into it with respect to structural racism? And if so, what are your ideas about that?
Well, like I said, the one thing I think we should learn that is how interconnected we are. That again, I'll express this, that when our neighbors are sick, then we are vulnerable. And that is true in a direct way as in our next door neighbors. And it's also true in terms of countries internationally. What happens in China will eventually happen here. What happens in Africa will happen here. We are interconnected. And so not only do we have an obligation of addressing structural racism in this country, we have what will be most preventative if we address structural racism globally. The other thing is, what we should learn is, anyone that's receiving any kind of relief check should be the first person that says yes to reparations. These are the moments where it's like we understand concretely that I need a boost. And by the way, this is our money. This is like the taxes we put into the government. These are the moments we should get them back. Instead, we've been giving corporations our tax money, or giving them breaks, letting them off the hook. But these are the moments where, oh, cut my check. Mm-hmm. That should be the demand. And so we can understand that now that people want to go back to work, but they can't. Same thing is true for Black folks. We've been wanting to participate in full employment for a minute now, but we cannot, because racism blocks us. Racism throttles our pay. Racism throttles our opportunity. So we need now more than ever to understand that some type of stimulus is needed. And I didn't even mention about the need for a social safety net. That's been clearly exposed. If we don't restructure our social safety net in this time, I don't know when we're going to do it. So I'll leave it there.
Mm-hmm. I'll kind of start from where he started and move out from a public health perspective. Stephanie and I had a conversation a couple of weeks ago, kind of when she reached out to me about this. And I was telling her about when this was in China and how I knew it would spill out. And I mean, I knew right away it was going to spill out. And I remember that the president, banned flights from China or Chinese from coming on flights. And I was thinking it's going to come anyway. It may take a little longer to come, but it's going to come if it's not already here. And in the case, by the time that we're now finding out that he did ban it, we probably did have cases already in California for certain, because now they've backtracked at least 3 weeks from when they know the first person died from COVID. So definitely things are interconnected. And I think looking at this in kind of recent epidemics that we've had, this lack of public health response, and it just really underscores what we already knew. We have to strengthen public health response. We have to strengthen public health facilities, health systems in this country, on the African continent, in China, in Europe, and everywhere. And I think it really exposed the West in a lot of ways, because I think people often look at the developing world and say, oh, they have these kind of inequalities in their health systems. They're not the only ones with inequalities in their health systems. I mean, look at the numbers, look at the people who died, at the numbers we have right now. The highest numbers are predominantly out of the West: Italy, France, the US, Spain. And so, it looks very differently than I think people envision that it would. But also, if you look at a lot of African countries and in terms of preparation and response, some of them might not have the resources in terms of economic resources, but they have the know-how. Because a number of them have had, different types of recent outbreaks of different things, of yellow fever, of Ebola. But also when we had the West Africa Ebola epidemic, there were only a handful of countries on the continent that were impacted, but many of the countries prepared. So they know what this looks like. How do you contain something very quickly? How do you put in contact tracing very quickly? And so they're doing these things already very early on. Some countries are more successful than others, as we're seeing right now. And I think, we're going to probably move there in terms of numbers growing in the next few weeks, few months, but the response is there. And thankfully, even some places that may not have had the equipment they need, they're having access to getting that equipment. A lot of it's coming from Jack Ma, but it's coming from others. And that will help them in being able to respond.
Great. Thank you. I just want to say that we are really thrilled that you both joined us on such short notice. We could not have thought of two better people to come in and help us think about this. Our students, I think, are really inspired by the ways in which you are bringing the class to a very life and death reality, right? Like, so what we talk about in class, from Thomas Jefferson all the way to Obama, all of that comes to sit in this conversation. So this has been wonderful. I want to say quickly, and then I'm going to hand it over to Adam for the last word. But thank you to Susan Kells, who is the queen of this whole thing. She had to deal with the Zoom bombers earlier on. And so our thoughts go out to her. Our thoughts and positive vibes go out to Andre at the town hall with these congressmen. Please, Andre, know that we are with you. I want to say thank you to my old friend, Donna Patterson, who was in grad school with me, and she's known me since before we both had kids. Thank you both for coming and for inspiring us. Adam, last word.
Yeah, I also wanted to thank Stephanie, whose idea is to have this event. It really was her idea, and she spearheaded it, and I want to thank her. And then also, second her words of thanks to Andre and Donna. Such wonderful insights, really important insights to share with us and to share with everyone. So thank you so much for your comments, and just such a powerful way to connect what we're doing in the course and in the project with what's going on in this moment and what's affecting all of us so powerfully right now. So So I really, really appreciate that. And I know all of our students and faculty do. So thank you so much for being here.
And if I could have one more word, Adam, if you all want to follow Andre and Donna, please follow Race and the American Story on Twitter. It's called race_Amer_story. We have tagged them both, so you can follow them both. And then Andre's new book, Know Your Price, is just dropped. And so please buy the book and help the brother out.
Help me out. Oh, right. I just want to say, let me say this to Donna. Donna is incredible, thoughtful, incredible woman that I only get to see when these pandemics occur. I hear, so I just want to send a shout out to her and her great work during these perilous times.
Thank you, Andre, and same to you. Thank you. We look forward to seeing what you do next.
Yeah.
Okay. Take care, everyone. Have a good weekend. Stay safe.
You too.